part of what you just said is, what kind of information would you like to know after your patient has gotten an injection at the pharmacy? So one of the things I guess I'm hearing is, what were the results of the rapid urine drug screen? But what other information, if you had sent a patient to a pharmacy for their naltrexone injection, what information would you want to hear back from that pharmacist about your patient?
Typically, like me personally, any other like substance use, if they report it, ideally though, hopefully I would know because I would have a telehealth appointment like close to there or have them in person a different day or, something along those lines. But ideally too, I would like to make sure that the rapid has fentanyl on the panel. Some of the, I know like point of care rapids don't. And I've noticed in a lot of my patients, unfortunately, as of recently, even if they're abstaining from opioids, they believe, but use, stimulants like cocaine, methamphetamine. I've even seen it in marijuana recently. It's laced with fentanyl. So I have that conversation with them often about how there might still be opioids in that, even if they don't realize it. So I guess just ensuring that is included in the screen as well.
What other information would any of you want to know from the pharmacist, say after one of your patients has gotten an injection?
I think that what's already been mentioned are the big things that I would be thinking of. So I don't have anything else to add.
What else?
What I was going to say is I would also want to know about alcohol use. I know that we use naltrexone for alcohol use disorder remission and maintenance also, but what I've been hearing is a lot of the focus on the different possible drugs of abuse, but also not forgetting to include alcohol assessment also.
Done with the shot, they'll send some information back to the prescriber about the actual injection. They'll send maybe back a form that says this is where, we gave the injection, we gave it in their left buttocks. This was the reaction that the patient had. Information like that. This is kind of briefly summarized. That information be useful or beneficial to you after your patient has received an injection?
I would say personally, definitely. We typically in our office alternate in the gluteal muscles. Say they would get their next injection in office. It would be really nice to know where their previous one was and if they had any like site reaction or immediate reaction.
Complete agreement with that statement. And then also just knowing the exact date of when it was given so that can be used for record keeping also.
And lot number and serial number too would be helpful.